I do think from a safety standpoint, we do have to look at the quality of the PPE that we're bringing into our practices, because we're the ones that are there dealing with the patients in that particular operatory all day long. If you have a clinician who's not feeling good, or they're wearing PPE, especially gloves that are encouraging ergonomic issues, you're going to have an ROI problem, because the hygienist isn't going to be able to perform, and you're going to increase workplace hazards and also incidents with, harming patients. As a clinician and as hygienists, it's time for us to start advocating. I'm a big believer that we need to treat our operatories as like a practice within a practice.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, and happy weekend. We have a special bonus episode for you with one of our favorite returning guests, India Chance. So in this episode, we talk about a lot of things. We always talk about a lot of things, I feel like, in all of our episodes. But in this one, we're really digging deep in personal protective items. India's phenomenal at explaining the why of what we need to be doing. And for me personally, I like to know the why, but sometimes if people can't explain it very well, then I kind of tune out. But India's not like that. She's awesome to listen to. A special shout out to Medicom for sponsoring this episode. They have a really cool history. You can read about it on their website. And a little bit of spoilers, their why for starting like in the very, very beginning, 35 years ago, was essentially to be an advocate for healthcare providers like us. So big thank you to them. If you want to read more about their story, if you want to check out some of the products and stuff that we talk about on the episode today, you can head over to medicom.com.
A tale of two hygienists.
Welcome in, everyone, to the interview portion of the podcast. Thank you so much for joining us. We are live from the floor, the exhibit hall floor at RDH Under One Roof. We're joined today by India Chance. We're going to talk about PPE and infection control and stuff and things.
Yeah,
right?
yeah, we're going to talk
back,
about.
buddy.
Yeah, thanks for having me, you
Oh,
guys.
gosh.
I'm excited. It's been a little while.
It has, and you know what? I was thinking about this earlier. I was like, we had OSAP on just as like kind of a refresher for the listeners who haven't heard about them in a while.
Right.
And then beyond that, we haven't talked infection control at all.
Shame,
So we're just
Andrew.
No, so sorry. It's just it's not.
It's not exciting.
It's not exciting. It's not
glamorous.
sexy. It's not something that
No.
everyone wants to talk about, but it's something that everyone has to talk about and everyone
Right.
has to do properly.
Yes, we do. So we'll try to make this funny and exciting, but I can't make any promises.
Yeah,
anyway.
this is going to be dry and boring. And then if it's okay to listen to, it's decent to listen
right.
to, let's set the standard.
Exactly. Yeah.
So where do we start with this?
I feel like we really should be starting with CDC guidelines and kind of where we are. I know this year we had the lifting of a lot more of the CDC COVID restrictions. Kind of started last year a little bit. But
Let's
this
talk about.
year,
Hold on, you say that like
okay.
everybody knows exactly what's happening.
Okay, I understand.
Okay, let's start for like the because what and that's the thing is like we were talking about this just yesterday.
Yeah.
It's like you have all these first timers, 600 or whatever first timers here.
Wow, that's
and
great.
like in the groups, they'll ask the most basic of questions for
Sure.
dental hygiene.
Sure,
And you're like,
yeah.
Oh, you don't know that?
Right,
And so
right,
there are.
okay.
I mean, there is just a lack of information. I think that does get disseminated to everybody.
Yeah.
So if you don't mind, just like dumbing it down for the rest
Yeah.
of us, aka Andrew
Okay.
from Florida, listening to this podcast.
Right. Okay. So the CDC is, a department in the government. They're not a legal agency. They're just basically their mission is to provide recommendations, and they collect data and they look at the data, and then they come together, they form committees, which is what they did back in 2003 for dental settings. And they brought into the committee, you had people that were in research, you had oral health care providers. So it was a committee that came together, looked at a lot of the data, scientific studies and things, and formulated what we call today the CDC guidelines for dental settings. And it was 2003, so a lot has changed since 2003, clearly 20 years ago, right? And for a long time, we were just kind of following those guidelines. And then fast forward to 2020 and COVID came along, and the CDC had an opportunity to look at those guidelines and say, where are the gaps? We've got to put some emergency kind of recommendations in place because this is the first time we've ever kind of dealt with a pandemic. And lo and behold, by the way, dental professionals are high risk for this airborne pathogen.
And we were
right
back in the op in
Right.
late May.
Oh,
We
hold on. We're gonna see if we can get this one edited in. What?
That's funny.
Okay, go ahead.
Yeah, so they came to the table and they made a lot of announcements and recommendations based on the science that was like coming out. A lot of moving pieces, right? We had the World Health Organization, CDC, we had, OSHA was involved. A lot of different agencies in the government were involved in what was going on. And so they put into place their recommendations, and they were called COVID recommendations, right? And so those kind of stayed in place really up until like last year almost. I mean, we started to see restrictions being relaxed a little bit as far as their recommendations kind of in 2022, right? But then towards the end of the year, things started to ramp up. They made the recommendation that anybody that came into a healthcare facility in September, they said, we're no longer recommending that you wear masks. We call that patient source control. So you're trying to control the source of an infection. And an example of that would be a face mask, surgical mask. So they said, hey, you can now allow, based on immunity levels and infection rates and things like that across the country. Most of the population was vaccinated, so all of the rates have lowered, everything's decreased. You don't have to require patients coming in with a mask. Okay. So then fast forward to this year, President Biden had signed in, he made, I think this was back in like 2021, he said May of 2023, based on infection rates and things like that, if everything is where it's supposed to be, we're going to lift all of the COVID restrictions. And that's what happened in May this year. Okay, so all the COVID restrictions were lifted, and then CDC came out and followed suit and and said, hey, there's still things that we recommend based on an aerosol generating procedure, and we can talk about that, but a lot of the COVID restrictions got rolled back and recommendations got rolled back. Now, I say all that to say that even though the CDC kind of relaxed a lot of their recommendations for COVID, because they're not a legal agency, we still have to follow what our state dental board or our state health department is saying. So there's still some states that still have some restrictions in place that other states don't have to deal with anymore. So I always put a disclaimer out there that you need to follow what your dental board and your state health department, because your state health department is really kind of the leader, and then the dental board follows that, and the dental board is who is supposed to communicate to you, and they are supposed to have it on their website. So if you're not sure, that would be where you would want to check to see about what your dental board says.
I feel like a lot of dental boards and or like your state practice act or whatever it is, they'll say like, whatever the recommendations of the CDC, like it's written in to many states.
Yeah, into their dental practice law. And so when you have that type of situation, those recommendations now become requirements. Yeah. And so that's where we kind of are now. We fast forward now to RDH under one roof, and a lot of us are dealing with, okay, we no longer have COVID restrictions anymore. We're kind of back to the basics. And so my response to that is, yes, we're back to the basics, but I feel like, my platform is delivering the safest dental visit possible. So if we're back to the basics, I'm encouraging everybody, go beyond the basics and implement best practices.
And we all got to see, the front line of what ends up on our face shield when we use our ultrasonic. And it was like, that was all over my face before.
Yes.
So many are choosing to still just keep them on. And
that's a best practice.
Right.
Yeah, absolutely. I mean, we learned a lot through COVID and even with the respiratory masks. I still have a ton of clinicians and practices where they're still wearing respiratory level masks.
Right?
Because they looked at the science, they understand, there was a huge public health advisory notice that came out last year on October 31st talking about dental unit water lines and the dangers of biofilm and how that's aerosolized and that's what we're breathing in and things like that. So that's why a lot of people are still wearing respiratory masks. But for those that are wearing surgical masks, it's important to look at the quality of the mask that you're wearing. We're kind of past the point of just buying what's on sale or who's got a deal, right?
Well, I mean, even with COVID, it was who had it.
Well, that's
Was it
true.
available?
That's
Who
true.
had it, and
Right.
also then, was it
Right.
$80 for a case, or
Of
was
course.
it
Of course.
$5,000 for a
But
case?
it's no
Right,
longer, I
right.
like the pink ones, and they're really
Right.
cute because they have the
Right.
butterflies on them. Now
Right,
it's like, what's going to be
exactly.
the
Is that a
the
thing
best
people
practice.
do?
I've seen it.
I never knew that was a thing.
Yeah. But I think still, though, I think that now supply chains have been restored. Now, I can't say that prices have,
Right.
reduced because, of course, with our economy and everything like that. But I do think from a safety standpoint, we do have to look at the quality of the PPE that we're bringing into our practices because we're the ones that are there dealing with the patients in that particular operatory all day long. And, I've walked into offices where there's not even a mask level that's even printed on the packaging, which is not
that
part
legal?
of the... No, it's not. It really isn't. It's not even really legal. And you're supposed to have the mask level, and then you should have kind of based on, the company and how they brand the packaging and stuff like that, you have to show like the levels. This is level 1, 2, 3, and then, highlight that it's the level 3, and then you put it on there and print it. And so, like I said, I've walked into offices, they don't even know what level mask. Most likely it's not even a level. It's like,
Amazon special.
It's like
yeah, very much so.
paper
and it's
towel, just right over, like a quilted paper towel.
A tissue, right? A tissue.
Well, they
so.
sprung for Bounty.
Yeah,
of
right.
course.
A little thicker
quicker
bounty.
picker upper.
Yes, that's what I was going to say.
But how do you, so assuming that you have some things on the packaging, like how do you even know if it's quality though? Like what,
Well,
are you just taking people's word for it at that point, right?
I think when you look at different types of masks, sometimes you can feel the quality. So the material is a little bit heavier. A lot of the companies have masks where they have a chin bar as well as, a nose bar. That's a little bit higher quality, going to give you a better fit. You want to look at the actual material, especially if you have skin conditions. Companies that have higher quality PPE are going to have those types of options for you. So you have a little bit that you have a choice, right? So a company that's a little bit higher end is going to have a lot of different choices for you to choose from. They're going to have different sizes potentially, right? And they're going to have different mask levels, right? They're not going to have just the one, mask level. So I think that those are some features that are important for you to look for. One other feature that you can look for is making sure that the company has a mask for someone who has sensitive skin, because that plays a huge role in different skin conditions and makes for an unsafe working environment, really, for the clinician, because now you're having to deal with PPE that's actually harming you and not protecting you. And so it's important to look for companies like that.
Well, your skin is your greatest defense.
Absolutely.
And if it's broken,
it's your biggest organ too, right? And you're right. And when your skin is damaged, it affects your immune system, which is actually the first barrier of protection. And then PPE is the second barrier of protection. And so that's why we have to make sure that as healthcare providers, we're not just protecting the patient, but we're protecting ourselves too.
Right.
And just on a basic level, it's uncomfortable when you're uncomfortable. Like if you're itching or something's uncomfortable, or you're wearing something that's not being kind to you, it's uncomfortable to treat patients. So looking at those types of features is always good.
What do you know about foam nose bridge things?
The foam?
Yeah.
The foam? So it just depends on those. I mean, a lot of people tend to get those sometimes because it helps to defog the loops and things like that. It's a little bit more comfortable for you.
Is it safe, though? Is it like good, better, best kind of situation?
I don't know that I would say that. I think a lot of people, though, will get a mask that has a foam strip on it for comfort, more so for comfort, because if you have somebody that's sensitive to like migraines and things like that, when you have the loop resting and there's not really a barrier to cushion it against the nose, sometimes that can encourage some headaches and migraines and stuff. And clearly, you really shouldn't be delivering dentistry if you're experiencing a migraine, because it just decreases the safety in the dentistry that you're delivering. And again, you're uncomfortable.
Right.
Yeah.
So,
And our partner in this episode is Medicom. So
Yes.
can you talk a little bit about kind of what their line looks like?
Yeah, I mean, I'm a big fan of Medicom. I've been a fan of them for a very long time. I actually didn't even know that they were Medicom. A couple of years ago, I realized, I was like, wait a minute, that's the name? And, that's some of what they're doing now is starting to bring some more brand awareness, because a lot of us who have been in dentistry for years have been using their products for a long time. A lot of your listeners have been using their products for a long time. One of the biggest things that I like about their mask options is basically that they have a lot of different options. They have a lot of color options. I know some offices are really into like matchy, and they
like
want
Mondays this color and Tuesday.
or they want masks
Butterflies?
to match. Right.
Butterflies.
They want masks to match the black scrubs and things like that. But they do. They have a safe skin option, which is great for those who have skin sensitivities. They have your traditional, a surgical mask. They definitely have the level of mask printed on the box. So that's always good. So a ton of options for you to really choose to see what's the most comfortable. Different price points, which is nice, because that's still a concern. A lot of your listeners are in offices where it is a concern. Price is a concern, and it's nice to be able to have choices. And so I think for Medicom, they do a really great job at giving you a lot of choices, which is always nice.
Well, I was impressed with their lightweight respirator mask, because a lot of people have been complaining about the ear pull and the weight. So that's cool.
Yeah, a lot of their masks just fit really well. And so, like you said, it doesn't pull on your ears or anything like that. They've taken a lot of time to be mindful of sensitivity, especially the skin around your ears and things like that, where the ear loops go, the length of the ear loops to the mask and stuff like that. So they're just very intentional, which is what I like. I like to work with companies who are intentional. They're not just thinking about the patient, but they're thinking about the healthcare provider too. And, we have to remember that PPE has a dual role. It protects the patient, but it also protects us, right? And so, like I said, they do a great job at protecting both of the stakeholders involved there, the patient and the provider, which is nice. So another thing that I like, too, that they offer are the glove options. They do a really great job at that.
Is it true sizing? That's the only thing that drives me freaking crazy, because I get large in one company and extra large in another company. Well, I'm like, these are not
you bring up a good point. You want to go with a company who actually has extra small, medium, large, extra large, right? Because every glove brand is not one size fits all, right? And so, like you said, one brand you could be a large, the other brand you could be a medium. So for the most part, they're pretty true to size.
Large and extra large, right? Okay.
Andrew.
Sorry, we'll cut that part out.
Do you like the ambidextrous or the ones with the right and left?
I don't care. Ambidextrous probably.
Yeah, me too.
Yeah, I like
do too.
ambidextrous, and that's what they have. They don't, have the right and the left. But yeah, I mean, they have several different options. The biggest feature that I like really about all of their gloves is the textured fingertips, which is really nice because, for a host of reasons, tactile sensitivity, things like that. They have a nitro glove, which is really nice. And a nitro glove is a little thicker, has a little bit more protection for you. Now, of course, a compliance consultant, right? These are not the gloves you're going to wear when you're dealing with contaminated instruments, but when you are, dealing with your dental instruments, they give you a little bit more protection. But then there's also the polychloroprene. And those are really nice because what they do is they're a little thinner. They give you the elasticity of latex, which is nice for flexibility, but then they give you the protection of nitrile. So, and they too have the textured fingertips and stuff like that. So far, those have been my favorite. But today, I was introduced to their brand new glove, which is called the True Aloe. And it's a thinner glove, so it's not as thick as the nitrile, a little bit thinner. But what's amazing about it is it's aloe infused and accelerant free. So for those people that have dermatitis and skin conditions, this is an excellent choice because it's going to help to keep your hands soft. And it's also going to help to keep your hands dry. Because, a lot of times we're working, maybe we're sweating, maybe we didn't dry our hands off enough, after performing hand hygiene. And so what's nice about that True Aloe is it's going to help kind of keep things a little drier. And so you're not necessarily going to have the flare-ups that you might have. So very nice. And again, that's textured for tactile sensitivity. That's a great option for those that have carpal tunnel, that are dealing with those type of ergo issues. So looking at features more, and as hygienists, I'm a big believer we must advocate for ourselves, right? And so it's a whole nother podcast to talk about how do you talk to your dentist about, the type of products that you would like, especially PPE, if it's not necessarily normally what you order or in the budget.
It's also not a profit generator, right?
Right,
like
it's not a
we're going to make
profit
more
generator.
money this way.
But I will tell you this, it's part of the ROI because if you have a clinician who's not feeling good or they're wearing PPE, especially gloves that are encouraging ergonomic issues, you're going to have an ROI problem because the hygienist isn't going to be able to perform, right? And you're going to increase workplace hazards and also incidents with, harming patients, right? And so it definitely indirectly relates to ROI. So that's a whole nother podcast. But, as a clinician and as hygienists, it's time for us to start advocating. I'm a big believer that we need to treat our operatories as like a practice within a practice.
Right.
So
do you mind running through, because I think it's been years probably actually on the podcast since we talked about, what gloves are appropriate for what part of the appointment, right? So bringing them back, working with the patients, and then kind of processing instruments and all that.
Yeah, so whenever you're delivering patient care, so any type of patient care, you're going to be wearing an exam glove, a disposable exam glove. So that would be, if you're taking an x-ray, if you're doing perio charting, if you're delivering, a prophylaxis, if you're, performing scaling and root planing, that's considered patient care, so a disposable exam glove. You are allowed to wear disposable exam gloves if you are using disinfectants. If the manufacturer of the disinfectant states that you're allowed to use disposable gloves in their IFUs, which is in instructions for use. If it's not on their label, then OSHA states you need to be wearing utility gloves. Now, I always say you should wear utility gloves because, regardless of what the manufacturer is saying, because not all exam gloves have the integrity to protect you from a chemical exposure, right? And again, we're talking about safety, right? So protecting ourselves. Once you move from the operatory, you're finished, you've dismissed the patient, you're walking to the operatory with your tray. Now is the time where you're going to discard those exam gloves, put on the utility gloves, and I'm not dishwashing gloves, okay? I've walked into offices where people have dishwashing gloves that they've purchased
Those
from
yellow,
that they purchased from the dollar store, right? They're nice and
Even
flowers
better.
and butterflies, right? They have the butterflies on them, right? Just like on the
Dollar
masks.
General for all you Southerners.
or a 5 and below for all you Northerners, okay? And so, so you're going to now don or put on the utility gloves, and then you're going to reprocess the instruments. Then when you go back to the operatory, if you haven't wiped your room down or something like that, you can put back on the exam gloves, or you keep on the utility gloves, whatever you want to do. Yeah.
I love it. Thank you.
So
for
is
doing
that like a good...
No, it's great. I just feel like everyone just uses exam gloves for everything.
Oh, yeah.
You know what I mean?
Yeah.
I'm just like, oh my gosh.
And I will tell you that wearing utility gloves actually is ROI for the office, because you're not using as many gloves, and so you don't decrease your glove supply as much.
All right, hold on. Controversy. Hold up.
Yes. Are
It's not a
utility
glove.
gloves
It's not
dirty
a,
or clean?
Not a glove inside a glove.
Not a glove inside a glove. You don't have to do
A
that.
clean glove inside of a dirty. Oh, okay.
Yeah, I know. A lot of people are
This-
going to comment on
you
this.
are so
They're going
right.
to say, no, I have to wear a glove and then put a clean glove on. Here's what I would
Yes.
say. Here's what I tell all of my offices, because, I go into offices. Buy or purchase a pair of utility gloves for each clinician. Then they have their own, and you can deal with them however you want to. If you feel that
Little
you would
clothesline
prefer,
across the office.
right? Well, that's true. I've walked in offices and everybody has a different color. It's really cute. It's like a rainbow sometimes. So you don't have to have an exam glove and then put on a utility glove. Now, obviously, if somebody's going to put on an exam glove, do something with it and contaminate the exam glove and then put on the utility glove. Well,
That's
you've
a
now
problem.
pretty much contaminated that utility glove. And moving forward, I mean, unless you're going to autoclave them, because some of them you can autoclave, right, and turn them inside out and, disinfect and then autoclave them. But no, you don't need an exam glove to put on a utility glove. And so... that is how
You're right
you
on. I'm
can
not trying to argue with you.
save
You're right
money.
on it.
I know what you're saying.
It just
Right.
feels wrong.
Safe to say it's personal preference.
bare
Yes.
glove,
Okay.
bare
Personal,
hand in that
totally
glove.
personal preference. There's no
There you go.
written rule or anything you can do.
I have
pretty
another
much
one
what
for
you
you.
want. Here we go.
No,
Andrew,
it's not- it's not that big
too
of a deal.
early in the conference
It's
for
not that
this,
big of a deal.
okay?
No, it's not that big of a deal. Okay.
Okay.
Do because when the pandemic hit,
Yes.
we all left our offices. We all came back slowly. All of a sudden, people are using utility gloves, right?
Yes, okay.
So you have this utility glove. It's dirty. Can you disinfect the outside of it with wipes or spray?
Yes. Yeah. As long as you
Do you do it
use
every
the
time?
disinfectant.
Do?
Yes, you should be disinfecting your utility glove after you've used it to turn over your operatory. It should not be hanging back in its place or wherever you retrieved it from dirty or contaminated. So you can do one of two things. You can spray them, spray, wipe, spray, whatever. You can spray it and leave it there. Most offices that I've gone into, because I'm also a state dental board inspector, and most offices will take a wipe when they're done and they will use it according to the instructions for use, and they will disinfect that, and then they will hang them in the operatories or in the sterilization area with its own hook and let it air dry. And then some offices take it a step further. At the end of the week, they'll just autoclave all of the gloves if they're autoclavable. So you got to make sure that you have autoclavable gloves if you're going to do that.
What about hand sani? Is that going to cut it?
No, not going to cut it. Not going to cut it. 99.9% of the bacteria, but not
plain-
TB. It's not like it doesn't have a tuberculosis claim, tuberculocidal claim on the hand sanitizer.
Yeah.
So that's what we're coming. Those are the pathogens that we're coming into contact with.
All right. So this is the last question here. We're going to let you off the hook. We're going to let you off easy this time.
I know. I was sweating over here, Andrew.
We have a lot of younger listeners, a lot of new grads, some students even.
Sure.
And I feel like they're always they want advice. They want thoughts from the experts like yourself. So in the infection control and the whole entire arena, what is a thought that you might have for them?
I think for the new grads, I think it's important for you guys to explore different companies and products. I know one thing that Medicom does is they give samples. And so I would encourage the new grads to get some samples and try out their gloves, get some samples. They also give samples of their masks. Try out use their products so that you can really see and feel the difference and see how it's going to work for you in the practice. That would be one of my biggest pieces of advice that I would give new grads, because you're not necessarily familiar with who they are and stuff like that, and maybe some of the features that we talked about earlier. So I would absolutely recommend getting samples and trying them out, especially if you're at dental conferences and things like
RDH
that.
under one roof.
Yes.
Shameless plug.
Your booth is really cute. There's cute colors over there.
Yes. It's definitely nice. Yeah, I would definitely recommend that.
Awesome. So if the listeners wanted to do that, where might they go to find that?
So they would go to medicom.com. That's medicom.com. So it's pretty easy. It's pretty straightforward.
Yeah, it is. But if anyone wanted to reach out to you personally, ask you some more questions about infection control, or maybe find out about speaking or anything else that you do, consulting.
So our website is www.learntoprevent.com. So that's LEARN, the number 2, and then prevent.com. And that is our social media handle, too. We're on Facebook, Instagram, and LinkedIn. So everything is Learn to Prevent, because we're always trying to do that. And there you'll, learn more about me and then the company and what we do and how we come into offices and, help different dental teams deliver the safest dental visit possible.
Awesome.
I love it. India, thank you so much for being with us.
Thank you guys for having me. This was exciting. I'm glad to be back, Andrew.
That's great.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.